much for joining today's NeedyMeds special topic webinar. Why do I need a health spending plan, really? Presented by PAC Health. My name is Carla. I'm the Director of Education at NeedyMeds. And we're going to go ahead and jump right in. For those of you, first of all, that are not familiar with NeedyMeds, what you're looking at on your screen now is our mission statement and how we achieve that mission. Basically, NeedyMeds' goal is to connect people free and anonymously through our website and helpline to programs that will help them afford or save on their healthcare expenses. And I always put a snapshot of our NeedyMeds homepage on all presentations because really our website is the face of our organization. And as you saw on the screen, a big part of our mission is educating people. And we define education in a couple of ways. One, certainly by educating people about NeedyMeds and the resources we have to offer, but by also letting them know other ways to stay healthy. And a big part of that is managing your finances, which is why we are so pleased to have our guest panelist here with us today. It is my pleasure to introduce Michael Morris. Michael is the director of our partnering organization, PAC Health. In his role as a national board certified health and wellness coach, Michael leads a team of managers and health advisors who work with people living with a chronic condition. PAC Health discusses health budgeting as one topic among 10 others to help people live and manage chronic conditions towards health and wellness during a 12-week intervention. He recently received his certification as a finance social worker through the Center for Financial Social Work. During this presentation, Michael is going to walk us through the benefits of a spending plan and how it specifically relates to your health. He's going to cover an array of topics from your household budget to chatting with your employer about tools available to help you plan for healthcare costs. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to our host, Michael. Thanks again, everybody, for joining today's webinar, and enjoy the presentation. Thanks so much. And Michael, I'll hand it over to you.
Yeah, thank you so much, Carla. Thank you for hosting this event today. And also thanks for the NeedyMeds community for tuning in, and for everybody else that's tuning in as well. So hopefully you'll gain some insights into, definitely why that people living with a chronic condition, or even people not living with a chronic condition, could benefit from having a health spending plan, definitely. And so thank you so much, Carla, for giving, a brief introduction and letting them know my certifications. I'm also a National Board Certified Health and Wellness Coach, and it was a recent certification. It was also offered by through the International Consortium of Health and Wellness Coaches and the National Board of Medical Examiners. So real excited about that, as well as the Financial Social Work certification as well. So, so why do we actually need a health spending plan? Well, first of all, there's a lot of money being spent on healthcare. The CDC states that 86% of the nation's 2.7 trillion annual healthcare expenditures are for people or living with a chronic health condition. And so that's a lot of money. It's a lot of money being spent by the healthcare system. And of course, there have been a lot of reforms that have been happening, since the Affordable Care Act was passed, that, as far as reimbursements, for health insurance, the Medicare and Medicaid, that providers are having to move away from the fee-for-service to a more value-based reimbursement model. And so they're going to have to prove that people are actually getting healthier as a result of the tests that are being run, medications that are being prescribed, things of that nature. But then also, there's a lot of money being spent from individuals. As the graphic shows in the bottom right-hand side, on average, people with a chronic condition spend up to 5 times more on healthcare than individuals that do not live with a chronic condition. So all in all, we really need a health spending plan, because of the amount of money that's been spent, in the healthcare related fee, in the healthcare in general. And this graphic, really, lets us know that all of these costs, all of these different things we've been talking about are interrelated. So for example, definitely from the individual standpoint, that they can benefit from, having better health outcomes. Better health outcomes mean lower medical expenses. Lower medical expenses means that, my lifestyle is definitely better. I can spend that money on other things versus my medical expenses. But it all starts really with health behaviors. And health behaviors kicks it off. And when we talk about health behaviors, we mean things like making changes in diet, exercise, medication adherence, just to name a few things that could really go a long way to improving those health outcomes. So individually, people can benefit from addressing these health behaviors and therefore having better health outcomes, and by reducing medical expenses overall. Recently had a member had been engaging, and we call our clients here at Pack Health members. But she was telling me that when she first came on board as a member, she was dealing with things like chronic fatigue, gastric esophageal reflux disease, among some other health issues. And she really just wanted to have more energy. So we decided to, get her to start tracking her diet and exercise routine. And, we learned a lot from that. And together we developed a plan to eat healthier, reducing carbohydrate intake, which was primarily the single largest component of her diet, those simple carbohydrates. And so we started making these changes. And, just a few weeks ago, she reported back to me that she saw her doctor, and under her doctor's advice that the doctor instructed her she no longer needed to take the medications. And some medications she was taking, like Linzess and other medications that were really expensive and really having an impact on her household budget, and she no longer had to take those anymore. And she was real excited to tell me about that, and that that she was saving money as a result of our engagement. And so you could see just by that one example that if health behaviors are changed, the medical costs and out-of-pocket costs to individuals can definitely go down as a result. And that's what we do here at Pack Health. As Carla mentioned earlier, our co-program is an initial 12-week intervention where the individual that signs up as a member will get a dedicated health advisor, and that health advisor will help guide them through this 12 weeks, where they'll be calling once a week to talk about one health-related topic related to managing their condition. And some of the topics are over there on the left-hand side of this graphic up here. We also follow up with members weekly through nudges sent by text or email, and then also weekly activity, which contains a micro lesson, which is a video, and a questionnaire to answer afterwards. And definitely one of the topics that we address is budgeting for your health, or health budgeting. And so we'll talk a little bit about how we do that as well. And one of the first things that we address is a spending plan, is a health spending plan. And really developing a spending plan is one of the first steps towards financial health, because it is a reflection of, our income and how we spend our income. And because our income is the most important resource for building wealth, or for maintaining, good health as well. Um, and that spending plan will simply list income and expenses. And part of, part of, you tuning in today to this webinar, we're going to provide a free resource to you, which is simply a really simplified spending plan that you can develop on your own and work through that on your own as well. And so, but one of the things that we really want to, make sure that's included on this spending plan are, healthcare expenses. Sometimes we leave those off of our spending plan, and so we want to include things on there like, co-pays, deductibles, premiums, and any emergency funds that we need to be setting aside for those regular healthcare expenses. Was talking recently with another member of mine, and she was saving money by having 90-day prescriptions instead of 30-day prescriptions refilled. But that developed another problem, which at 90 days out, she had to go ahead and come up with that money every 90 days to get her medications. And so on that 90th, on that every 3 months, she was having this expense that was a little bit more than what she anticipated versus the monthly expenses. And she really didn't track any of that, and she really didn't plan for that. It just all occurred on that 3rd month. So we began to talk together and develop a plan of breaking that up into monthly costs and making sure she's saving that money and budgeting aside every month in anticipation of that 90 days that's going to come on a regular basis. So with a little bit of planning, by planning ahead, it can really help individuals to manage costs associated with living with a chronic condition. And we really need to factor those costs into our budget every month, even though we may not be spending that money every month, just to make sure that we're setting it aside and planning ahead for that. And also thinking about developing an annual spending plan where we include all of those costs. And that can really be easily done by tracking our expenses that we're spending on healthcare and coming up with a really good annual amount and then spreading that out over a monthly period as well can really be helpful towards budgeting that money aside. And year to year, we revisit that and update it as needed, because being prepared for those costs well ahead of time can really help us to manage a chronic condition, even for people living with a fixed income. And so once you develop this spending plan, a couple of questions that you may have is, so what do I do if I have more income left over? Well, congratulations, you're ahead of the game. So you can start, delegating that money where you want it to go, whether it's, and we'll talk about some areas related to healthcare expenses that you can start, setting aside that money for in savings. But then also, so what do I do? If I spend more money than my income? As an old saying, not, too long ago when I was growing up, a lot of people said, I have more month at the end of the money. What do I do? So what do I do if I spend more money than my income? Well, congratulations. First, you have made the very first step towards discovering where your money is going. And so then you can start to address this issue, and you can address it a couple of ways. First of all, possibility of increasing your income. You have to look at it there, or just looking at ways to reduce expenses as well. And so you could do that by just looking at needs versus versus wants, and really having a hard look at monies that are coming in and going out, and really making some smart decisions there of ways to cut back. And we'll talk about ways you can save money in just a few minutes when we think about healthcare expenses, which is a big chunk of our budget. So some of the things that you can definitely think about, when it comes to saving money is, first of all, having the importance of good health insurance is really important. And really, health insurance, because if you think about it, if you have to spend out of pocket 100% of your healthcare expenses, it would really be a hard burden. And so it's really important to, have good health insurance and maintain that. Um, and so that's a really important thing to do. Secondly, saving for medical emergencies is also important because we're going to have irregular costs each year associated with our healthcare expenses. And a really good point of reference here, or a really good point to really, well, how much money do I need to set aside, is look at that deductible on your health insurance policy. So for instance, on my policy, it's $1,200 deductible for myself and my family. And so what I need to do is look at that $1,200 deductible and set that aside in a separate savings account so that if I have a medical emergency, I'm responsible for coming up with that deductible prior to my health insurance paying for anything. And so I'll have that set aside. So it gives me a little bit of peace of mind, when it comes to those things. And, as I use that, I may not use all of it, but if I use some of it, I'll replenish it as soon as I can. Also, take advantage of some employer-based financial products. Carla mentioned earlier, we'll be talking about this, and there's definitely a way to save money here with that. So, one of the things, a couple of healthcare employer-based financial healthcare products is one of those is a flexible spending account. Many of you may be familiar with this. But a flexible spending account is essentially monies that are taken out of your check every time you get paid, and it's put into a special healthcare fund. And many times these flexible spending accounts, you'll have a debit card that makes it really easy to draw from these expenses. And so you would just essentially set aside a designated amount of money out of your check each year to go into this flexible spending account. The advantage of this is that it's pre-tax, that this money is taken out pre-tax, which helps save money on your tax burden. Another employer-based healthcare financial product is health savings accounts. And this is especially important if you have a really high deductible. I mentioned earlier, my deductible was $1,200. You may say, wow, that's really good. My deductible is like $5,000 or $6,000 or $10,000. What do I do, right? So taking advantage of the health savings account is really important here. And it works very similar to the flexible spending account, but you'll designate monies, to set aside each week or every time you get paid, and it will go into this savings account, that you can set aside for your deductible and those expenses that you're going to have with healthcare. And another advantage of that, again, is that those monies are taken out pre-tax, and that really is really important. So if you think about it, if you have like a $45,000 annual salary, if you designate $3,000 of those dollars to go pre-tax into either a flexible spending account or your health savings account, then you're only going to pay tax on $42,000 instead of $45,000. So you can see how that can save you some money over the long term. And then also think about using things like using the emergency department or the emergency room wisely. Definitely, if it is an emergency, go to the emergency department. But if you have a non-emergency and go into the emergency room, there's typically a higher copay that's associated with that. I know on my personal health insurance policy, if I go to the emergency room or emergency department and they deem it not an emergency, then I could pay upwards of a $300 deductible. versus if I just go to my primary care physician and follow up with him or her, with a $30 copay, which is my usual expense when I go see my doctor. So you can see how that can definitely save you some money in the long term. And then also looking at medication costs, doing things like, we talked about earlier with that member story, having 90-day fills versus a 30-day autofill on your prescriptions could save you some money. On generics, if you can save some money there, that would be really important. If there are, instead of brand name medications, that could save you some money. And also to just discuss with your clinician, prescribing clinician or pharmacist, because they're very well aware of higher costs that are associated with healthcare expenses, especially when it comes to medications. And so don't be afraid or, think that they're going to think any less of you if you talk back to the doctor and just say, look, I can't afford this medication. They're very open and will work with you often. For instance, I had a doctor, one of my doctors, prescribed for me a prescription fish oil supplement called Vasipa. And I didn't think anything of it. I took the prescription to my pharmacist and said, hey, I just want to fill this. I'll pick it up later. Came back to pick it up later, and the pharmacist said, I don't know if you really want to fill this or not because the insurance didn't pay for it, and it's going to cost you $650, to fill this on a 30-day supply. Of course, I said, thank you so much for letting me know. And yes, I do not want to pay for this out of pocket. So what I did was I talked to my doctor. And so I called my doctor and said, hey, this is what this is going to cost. He said, swing by the office. And he provided for me a copay coupon that will work with my insurance. And so it really dramatically lowered my cost to $9 a month versus $650 a month. So definitely, if you're really having a hard time struggling paying for your regular medical costs or medication costs, then definitely talk back to your doctor, talk back to your pharmacist to get a medication review and to see if there are other options, that are available for you. So where do I go? So you say, well, Michael, you talked about a lot of different, products like these financial products from my employer, insurance coverage, copay coupons. Where do I go, right? So I'm so glad you asked because this is what we're going to talk about this time. The first thing is getting access to health insurance coverage. If you don't have health insurance coverage, I want to encourage you to, coming up in October, November-ish, especially the fall, going to the Affordable Care Act website. If you're not employed, to get, individual coverage is probably the most important thing that you could do. Also along that line, so the Affordable Care Act website is healthcare.gov, by the way, and I'll provide a slide to give you that information as well later. But also Health Sherpa is a good way to shop for these costs. Health Sherpa was developed not long after, it was like the weekend when the Affordable Care Act website was launched. I don't know if many of you remember when it was launched, but when it was, it really didn't work. It was really, really unfortunate that happened at that time. And so these couple of programmers working for that were students at MIT got together in their dorm room and over the weekend developed a website that later became Health Sherpa. That really, if you put in just 5 pieces of demographic information about yourself, you'll begin to see, you can really see the plans that are available in your state, in your county, that are available for you, and the prices are there as well. So check that out. It's a really good resource. Highly recommend it. Also, for those employer-based financial products, like I talked about, the FSAs, HSAs, go to your, if you're working, go to your human resource person, whoever that is, or go to the department. They can definitely, will share with you the benefits that are available for you. Definitely, if you don't have health insurance and they offer health insurance through your employer, get it there, because those costs are really lower in premiums going with it in a group plan versus an individual plan through the Affordable Care Act website. And so you can go to your human resource department for those. And then also for copay coupons, patient assistance programs, health education, wonderful webinars. NeedyMeds is really your go-to resource here. And as Carla mentioned in the introduction, they offer a lot of resources for individuals, people living with a chronic condition that can really benefit you. So check that website out as well. So one of the last things I really want to cover today is I want you to imagine with me a scenario. You're saving for you're beginning getting a handle on your finances. You're developing a health budget. You're setting aside monies for these regular, irregular health costs that are coming out of pocket. You may have less debt as a result. And the result of that is, I can imagine that you're really managing stress a lot better, because finances can be a major source of stress in our lives. And stress is a major driver in, health outcomes as well. And so really getting a handle on our finances can really help us to manage stress, which can really help us to manage any chronic condition. And so not only doing things like, addressing the financial area of our life, but doing things like getting regular exercise, eating healthier, maintaining good social support, sleeping well, anything that works for you. The things that work for you to manage stress is really important. But definitely, having, managing your health as well as your finances, and getting better financial health can really help us to sleep better, have less stress, and make us definitely happier and healthier, live happier and healthier lives for sure. So with that, that's really, my main focus for today. Thank you so much for tuning in. Here are the resources that I mentioned. You can jot these down. That I mentioned during our talk today. Thank you so much for tuning in. And Carla, I'm going to hand it back over to you.
Great. Thank you so much, Michael, for taking time out of your day to share your expertise with the NeedyMeds users. We're very fortunate to have you because, as you said, there is no doubt that handling your finances can be a real source of stress. And I know you can certainly put me into that category. So thank you for offering some resources and tips on helping NeedyMeds users get a better handle on that. And hopefully in just a moment, you'll be able to see my screen. I'm not sure, can you see it just yet, Michael?
I can, thank you.
Great. And so to our audience, bear with me. Hopefully that screen will be a bit larger. But in the meantime, one of the things that I want to stress is that, as I mentioned in the beginning, and Michael also had an opportunity to address, we hope you do rely on NeedyMeds as a source of cost-saving support for your healthcare needs. What you're looking at on your screen now is just a quick snapshot of the resources we offer to help you save on or afford your healthcare expenses. I'm not going to go into those now. I just wanted you to see a snapshot of some of our most popular ones and let you know if you're interested in learning more, please visit our website. And you're looking at that contact information for both our website as well as our toll-free helpline. So I encourage you to visit our website when you do have time or reach out to our call center counselors. They're here to help. I also put up the PAC Health contact information should you have any questions. And we do encourage you also to check out our YouTube channel. You can find that and all of our other social media icons on the top right hand of the NeedyMeds homepage. And I encourage you to check out that YouTube channel because we do upload all of our special topic webinars after we've converted them into videos so that you can use them for reference, share them, and hopefully get some more information about staying happy and healthy. With that, thank you again to Michael for your presentation today, and thanks to the NeedyMeds users for taking time to join us. Have a happy and healthy rest of the day, everyone. Thank you.